Okay, so let's talk about cataract surgery for a minute. I'm going to talk to you for a minute now, and then I'll come in a couple of minutes and I'll answer any questions that you have as well. First of all, let's talk about some basic anatomy and sort of what cataract surgery is. Within the eye, there's a lens, and the lens becomes cloudy. That's what a cataract is. So cataract surgery is simply lens replacement surgery. I take out the natural lens, and I replace it with an artificial lens implant that goes in the same area that the natural lens used to go. I only use the most advanced technique that's available for my patients because that's the safest and most efficient way to do surgery. The first thing you'll be happy to hear is that we don't need to put any needles around or behind the eye to do any injections of any type. So it's a little bit less risky for you and less scary for you as well. It also means that you won't even need to wear a patch after surgery. The incision that I make is 2.5 millimeters, which is roughly 1/10 of an inch if you're not a metric person. And the way that I make that incision, it seals itself shut without any stitches. And again, all of this is designed to make this a very easy, efficient surgery for you to go through and to heal up from. Certainly there's some things that can go wrong, and I always talk to my patients about the risks of surgery. There are really 4 risks that I worry about. Those 4 things are infection, bleeding, swelling, and detachment of the retina. Now there is some good news. All of those things are rare. They're also all preventable. And in the rare instance that they do happen, we've got more medications and more surgery to treat them. So the bottom line is it's very, very rare for us to have any damage or loss of vision from cataract surgery. The surgery is done on an outpatient basis with just sedation and eye drops and gels to numb your eyes so you won't feel any pain. And that means that your stay at the surgery center will be somewhere between an hour and a half and 2 hours. My actual surgery time is really only about 10 minutes once I get into the room with you. The next thing I want to talk to you about is the availability of laser cataract surgery. I'm a very big fan of laser cataract surgery because it has 3 big advantages over standard cataract surgery. It only has one disadvantage, and that's that insurance will not cover that portion of your surgery if you choose to have the laser done. And when Mary Jo comes in a minute, she'll talk to you about scheduling, where and when surgery will be, and she'll also talk to you about pricing for laser cataract surgery. The 3 advantages and the reasons that I like the laser, by the way, the laser is done in pre-op. So I come out and meet you in pre-op. We go into the laser room to do your surgery. The laser part of your surgery. The laser will do 3 things. It'll soften the natural lens, it'll soften the cataract so that when we actually get into the operating room, the lens is softer and therefore easier to remove. So it's a little safer, a little less traumatic for your eye. The second thing the laser will do is make one of the incisions that needs to be a circle. I make a very good circle by hand. I've been making that circle by hand for almost 30 years. But the laser makes a perfect circle right where I want it every single time. So I just can't offer you that sort of precision when I'm doing the surgery by hand. And then the third part of the surgery is really more of the fun part of the surgery, which is that the laser will also help us correct astigmatism. So if you have any astigmatism, we correct that. It means you're going to have great distance vision without any glasses on, somewhere between 20/25 and 20/20 with no glasses. Now the only other disadvantage when you just do the laser is that you've got great distance vision, but you don't have any intermediate or near vision unless you put glasses on. I have a solution for that as well. I've got 2 different types of lens implants, and we'll talk a little bit about which one or a combination of the 2 would be the best for you. But the 2 lenses I like to use, there's one called a Crystalens. The Crystalens is actually a flexing lens implant. So when you're looking off in the distance, the natural position of the lens is sort of back deep in the eye. And when you go look down and in to focus on something up close, like let's say you're driving and you want to look at the dashboard, the lens implant will actually flex forward. And that'll focus you on the dashboard. And then when you look up again, the lens goes back to its natural position and you end up with your distance vision back. This is a lens implant that's dependent on your muscles to make it work well. And it takes some time to build those muscles up. You know, at this point, you've been wearing bifocals or reading glasses for a long time. And so it takes some time to build muscle. It's kind of interesting because within 6 weeks, you're actually going to have what I like to call dashboard to distance vision, which means that you'll be able to see to drive, you'll be able to look down and see your dashboard, and you'll be able to look off in the distance and see well within about 6 weeks. But to truly get the full effect of this lens, the official data from the company states that we should tell you that it's about a year building muscle. And the way you build muscle is by using reading glasses that are weaker and weaker as you get stronger and stronger. So eventually at the end of a year, you're only using a very, very low power pair of readers, and you're only using them occasionally. You'd use them in a dark restaurant to read a menu. Fine print, crossword puzzles, pill bottles, recipes. When you're doing something that's a little more challenging near, like balancing the checkbook, and you've got to be really precise and you don't want to spend a lot of time and effort on it, that would be another situation where you might be wearing readers. But that means that about 90% of your day goes without any glasses at all. The other option is a lens implant called the Panoptix Trifocal. And the trifocal lens is different. It still has a central optic the same way that the crystal lens does, but within that optic there are rings of power. And so those different rings of power give you different focal points. And that lens is designed to give you 3 focal points, one in the distance, one intermediate, and one true near vision. And so the advantage to this implant is you're more likely to be 100% independent of glasses if we use the Panoptix lens. It has a slightly higher glare profile, meaning that there are some patients that have some significant glare when they drive at night over the crystal lens. But that seems to be pretty minimal, and the advantage of being able to read all the time really seems to be the reason that my patients enjoy this lens. And I may even talk to you about a combination of lenses where we use the crystal lens in one eye and the Panoptix lens in another, and your brain will kind of blend everything together. And that may be an ideal way for you to kind of fill in all the gaps and really be 100% independent of glasses. You don't have to make any of these decisions today. Mary Jo is going to talk to you about where and when your surgery will be. That's the only thing you have to get done today. You'll have some time to think about this, and Mary Jo is going to give you some literature to assist you in this decision as well. So, we'll figure out when we need to know. Mary Jo will tell you when you need to know, when you need to let us know about lens implants and lasers. But right now, the goal was just to give you this information. I'll be back in just a couple minutes, and we'll have an opportunity to chat a little bit. You can ask me any questions that you might have.